Can you introduce yourself?
I'm Kevin Hohn. I'm an Australian esports physiotherapist. I work with 1HP, which is a global team of health professionals passionate about health and gamers. I'm also an associate lecturer at the University of Sydney, which involves teaching physiotherapy students and conducting musculoskeletal research.
What is your educational background?
So I have a bachelor's degree in physiotherapy, and I've also have a PhD in medicine and health.
I've heard that carpal tunnel is often misdiagnosed in esports. Do you have any comments about that?
So there's no concrete published data about carpal tunnel in esports, but the general consensus across musculoskeletal health professionals is that there are very, very few cases of carpal tunnel. So for example, in the team I work with at 1HP in 2020, we looked at 132 esport players, and none of these players which had conditions, none of them were carpal tunnel, and most of them were some sort of tendinopathy.
What are the most common injuries in esports?
The real answer again is we don't really know because there's not much research. So according to a 2008 study, eye strain seems to be the most common, followed by neck and back pain. There's a more recent one that came out in a few months in 2020, which was saying that the neck was the most common, but I don't believe that study looked at eye strain. Like I just said earlier, in the team, so from the clinical experience, we mostly found wrist and hand injuries, and to be more specific, wrist and hand tendinopathies. So in terms of shoulder pain, we do definitely see them as well. Headaches can often come from the neck, so we call it cervicogenic headaches. Not as common, but possible. And there are definitely some sort of conditions which do involve the nerve, but don't jump the gun. It's not carpal tunnel most of the time. It could be the nerve being slightly irritated as it travels down the arm or in the neck, and often can get resolved with the proper management.
Can you just briefly touch on the typical symptoms, treatment, and the recovery on each one of these injuries?
So if we start with tendinopathies, so the tendon, most people report pain which is described as burning or like a pulling tension type of pain. If it's to do with the muscles, which often is due to them being fatigued or overworked, it's often like a soreness symptom that's deep inside. In terms of treating them, it's like almost any physical therapy or physiotherapy assessment where we need to go through all these different motions and work out what exactly is the anatomical structure that is causing symptoms and what the player is going through to load it up. So that ties into then load management, so what the player is doing and adjusting how much they are doing that particular activity or how they do it. And then looking at how well their body is able to handle that load, which is, for example, how strong they are. So that could come with exercise, or if the muscles need to be stretched because they've been too tight, then there's stretches. And sometimes treatment can involve some pain relief. So massage and ice can be quite effective. But of course, if the prior things I said aren't addressed, then massage and ice really are kind of like a band-aid and don't really target the problem. If you want to think about the timetable, like a prognosis, if we kind of package tendons and muscles generally in esports as overused conditions, if someone kind of presents day one when the symptoms had just started, then most of the time they can be resolved within 3 months, if not much earlier. But if someone kind of comes in and goes, oh, hey, Kev, I've had this for like a year already, then often, of course, it will take a bit longer. With the nerve symptoms, they also take a bit longer as well, but it's the same general principles of looking at what they're doing, how much they're doing it, and there are more different types of exercises that can be helpful for nerve symptoms.
Going back to the eye strain, do you have any insight on blue light glasses in terms to prevent that?
Two things. Eye strain is often due to looking at a screen for a prolonged period of time because the eye muscles, you got muscles to help you open the eyelids and to also close the eyelids. So if you're staring at something, it's the first one that is working a lot. So really it's all to do with time. So there's a 20-20-20 rule, which is every 20 minutes, you look at something for about 20 meters away for about 20 seconds. And that's usually the best way to handle it. When it comes to blue light glasses, the theory behind it is mostly due to the light affecting your sleep, which has been proven to have some effect. But a bit of sleep research and thought is from technology is actually less about the blue light being the main cause of someone having poor sleep. It's the fact that people are often on their devices and it eats into the time that they would be sleeping, and then they sleep less in general anyway.
How do you prevent the majority of those other injuries, the back pain, the wrist pain, and the tendon issues?
Back to before, I guess in a super general sense, it's really just about how much load you put on someone's body and how well that body can handle it. So in terms of prevention, we just need to make sure that if you are playing lots of games, then obviously there's more load there, then you need to make sure your body is conditioned for it. Now, of course, there's a limit in that. Your body isn't invincible, so that you can just have an infinite amount of load and there'll be no problems. So even if your body is conditioned, which is exercise, we need to make sure that when you are playing, now are there breaks? How many hours are you playing throughout a week on average? And if you're looking at the competitive esports, it will depend on the year. Like, is it in season, off season? Are they doing scrims or training, etc.? But if you have a good sense of what the person is doing, then it's about managing that. And then those are the two key things. The third thing is just the most popular question, which is the posture and ergonomics. That plays a really small percentage compared to the other two things I said. So of course, if you have better posture and if you've got a better setup, the amount of time spent playing will load your muscles less in comparison to a position or setup that is not as optimal. So look at the first two things first, load and the exercise. And then, of course, the posture and ergonomics are something that can be improved as well.
Do you have any recommendations for exercises before, during, and after gaming to prevent injury, including the reps and the sets that would be needed?
Yep. So there's many different types of exercises, but generally speaking, we can think of it as stretches and also endurance/strength training. So with the stretches, they're actually good before, like a warm up, during, if you have breaks between games, and also afterwards. And actually, if you only had to choose one time to do the stretches, I would suggest afterwards, because stretches work best when the muscle has been already used and they're getting a bit tighter, so to speak, and you want to stretch it out. If we talk about the strength and the endurance exercises, it depends on what the person's aiming for, but usually a lot of the mechanical movement someone would be doing with their arm is more on the endurance side. So we want an exercise that someone could probably perform about 15 to 30 repetitions before they get fatigued. And then you want many sets, such as somewhere between 3 to 5 sets. That way it's kind of replicating the load that someone needs to do when they play, which is doing a movement continuously for a long period of time.
What can esports athletes do equipment-wise to prevent injuries?
So this goes back to the posture and ergonomics. So the first thing is that people have different body shapes and sizes, of course. So the best way to kind of tackle this problem is if you have equipment that's quite customizable, that makes it quite easy for the person to then adjust and then have it suit them. The position of the equipment, so where your mouse and keyboard is, and even your monitor, is probably more important than the type of keyboard or mouse that you have. Though, of course, depending on the equipment, that might affect where your position is. So the general kind of ergonomics that you have noticed, where the monitor should be about an arm distance away, your eye should be either at the top of the screen or at least looking slightly down at the top quarter. Your forearm should be supported in some way, so either at the armrest of the chair, or some people will prefer playing with their forearms on the table. Again, there's no one that's better, but it's better to have the forearm supported. And in terms of the angle of the keyboard and the type of mouse, so some people have bigger hands, so it makes more sense to have a mouse that kind of fits their hand rather than something small. But of course, it also comes down to how they grip their mouse. So that's getting super technical now. With the keyboard, there's different types, but if the general rule is to think about your hand. If it's kind of bending too much to the thumb side, we call that radial deviation, or to the other side, which is ulnar deviation, then that would stretch and or shorten the muscles on their respective sides, which will make it less optimal. So again, the positioning of the equipment is most key here, but of course, different keyboards will allow that position to be easier for the player to be used to or not.
Are the younger esports athletes more prone to injuries than older athletes, or is it vice versa?
So we don't really know. Again, there's no published paper on this. What we do know is people who are older tend to have a slow recovery rate. So if we're thinking about overuse, when you use the muscle, it's kind of losing HP in its health up, so to speak, in gamer terms. And then when you rest, the HP bar kind of regenerates. But as you're older, that regeneration rate is slower. So that kind of points to me thinking that older people might be more prone. The other thing with overuse injury, obviously, there needs to be a period of time. So it's often loading over a couple of months or years that has developed this. So someone who's younger might not. But this is the assumption that younger and older players play the same amount. So if a younger player is playing heaps more than the older, then of course the load imbalance is going to be an issue. So really there's no answer that I can give you concretely, but this is these are some insights I can think on this.
As a medical professional, how does communication work to relay information about an esports player's injuries to their coaches, their managers, or even their parents?
So it's very similar to traditional sports where, of course, as a health professional, in general, you don't see the player as much as the coach would, or perhaps even the manager. So the player and coach has the most kind of tight-knit relationship. So there's no point kind of just telling the players things and then not tell the coach. So often when it comes to should someone continue playing or do they need a break and be off for a period of time for the rest of the season or for a bit of the season, it is very important to really communicate your recommendations to the player and the coach, and they are the ones that decide to continue play or not. So there might be decisions going, yes, if you kind of continue playing the next 2 weeks, look, it's going to get worse. But then if the context is, look, it's the grand final, it's the Worlds, and it's going to be all over in 2 weeks, and then the next tournament isn't as important, then obviously they can make a decision to continue playing. It's the same with their parents. So, of course, if the player is, depending on the legal age, if they're young and they need to have parental consent or help in their decision making, then it's the same thing where you need to inform the parents, and they might have the big call in their relationship on whether or not the player plays or not. But if someone who's 25 or closer to 30, then of course the parents aren't so much a factor. But the managers are also important to communicate with, because in the end, a manager looking at all their players will want to see who's playing what and how much and why. So rather than them working it out at the end, it's always good to just have that feedback communication loop. Basically, as soon as possible, everyone knows what's happening with a player.
Do you have any advice for anyone that's looking to get into the esports performance field?
So performance or health, same tips is it's a new field. As much as we like to think as many of us, there really isn't that many of us, and we need more. So really put yourself out there. So feel free to reach out, and of course focus on what you're professionally good at. So as a physiotherapist, I am of course good at what I do as a day job, and then transfer that into esports. So if you're good at exercise, or if you're good at dietetics or sleep, then of course make sure you're really good at what you do for your main job for the general population, and then just reach out, and then opportunities will come. You might not always get a reply or acceptance by someone the first time, and that's just how networking works. But persevere, and there will be someone that will hear your great ideas.
How can people get in contact with you? Do you have any social medias or an email?
The easiest way would be through Twitter. So at Kev_physio, that's PHYSIO. There you can find my personal website, my academic work, and esports content as well. I also would probably suggest you to look at the team I work with, which is 1HP. So 1HP has their own website, which is 1-hp.org. It's got a YouTube and TikTok for those who are more into those. And there's lots of information which is a bit more detailed than what we just said in this interview.
Okay, thank you for your time, Kevin.
No worries. Thank you, Russell.